Habari za mchana. I hope I said it correctly. Good afternoon, everyone, and thank you so much for having me here. I know I'm the last presentation before lunch, so I'll try to be brief. So I'm going to take you through an intervention we did using HPV DNA testing to target at-risk young mothers living with HIV in need of cervical cancer screening in Zimbabwe. Next slide, please. Oh, it's me. So I'd first like to thank my previous speakers. I've already covered a lot of ground here, especially around cervical cancer. As I'm sure you all know, it's one of the fourth most common cancers in women. The vast majority of all deaths are in low and middle income countries, and the highest rates of cervical cancers and deaths are in sub-Saharan Africa, where Zimbabwe is, Central America and Southeast Asia. Women living with HIV have a higher risk of developing cervical cancer, and it disproportionately affects younger women, which is why it makes it so relevant in this forum. So what causes cervical cancer? As I'm sure most of you are aware, it's human papillomavirus, which is a sexually transmitted infection, which, if it's persistent and left untreated, causes 95% of all cervical cancers. And normally it takes about 15 to 20 years to develop cervical cancer from infection. But if you have a depressed immune system, such as someone with untreated HIV, it can take as little as 5 to 10 years. And risk factors for cancer progression is the oncogenicity of the HPV type, immune status, the presence of others, STIs, number of births, and young age at first pregnancy. So what is the WHO recommendations for preventing cervical cancer? The foremost prevention is to prevent HPV infection, and you need to do that before someone gets infected with HPV. And then WHO recommends screening from age of 30, or if you're living with HIV, age of 25, and then to treat if you find some changes. And if you have early detection of both changes or even cancer, a cure is possible. And the types of treatment is both heat, cold, and cutting it away, basically. So women living with HIV should be screened every 3 years from age of 25, and the global strategy also encourages 2 lifetime screens with high performance HPV by age of 35 and age of 45. And you can do this using a swab with self-collection, and it's equally effective as a healthcare worker doing it. And after a positive test, you need to go for screening using, for example, visual inspection with acetic acid. That's when you put a swab with acetic acid, you insert a speculum, and you visualize the cervix, and you take a picture. So what's the situation in Zimbabwe? Newlands, which is one of the very big clinic with a big cohort that's been operating for a long period of time and has a very good documentation system, they published an article where they saw that women living with HIV who are 18 to 25 had a 2-fold increased risk of having suspect lesions. And that was the same for women living with HIV who had children. And if you were single, you had a decreased risk of having a lesion. So basically, young mothers living with HIV have increased risk of suspect precancerous lesions. So what was the limitations of this study? It's that they only did VIAC, and as they said in the article, there's a lot of noise in this population. Young people may have STIs or other things that look like lesions but are not actually lesions. You need to confirm those findings. So that's why we designed an intervention. So Shandiri, as was presented, we provide peer-to-peer support, and we are very proud of our Young Mentor Mother program, which is young mothers living with HIV, providing peer-to-peer supports to young mothers living with HIV. And our programmatic data showed that we had a comparatively high proportion of lesions among young mothers living with HIV. So we collaborated with Her Voice Fund and Population Solutions for Health to use HPV screening to identify those at risk of precancerous lesions among our young mothers living with HIV. So we did this across 10 districts in Zimbabwe, and I'm very happy that one of our previous speakers talked about the importance of having young peers mobilizing for these services, because that's exactly what we were doing. We had our young mentor mothers mobilizing for screening using the swab, and those that screened positive were then mobilized once again for VIAC, and if they had VIAC positive, we linked them to services, to prevention services. So we managed to mobilize 183 young mothers living with HIV for high-performance HPV screening. And out of those, 62% were successfully screened, 39% screened positive, and 93% accessed VX services. So this was a huge feat. Many of the young mothers living with HIV, they were hesitant to take up these services. They were scared of the stigma of being seen as someone who was sexually active. They were scared of the pain of having a speculum. But through having a young mother who had themselves gone through this intervention, who could say that, I've done it, it wasn't so painful, I managed to treat, and now I'm safe, they managed to ensure that those that screened positive, all of them were accessed VX services, except 3 who were pregnant and therefore not eligible. So out of those that were screened using VX, 15% were identified as having abnormal tissue, 1 had low-grade dysplasia, and 2 had high-grade dysplasia, and they were all linked to preventive therapies. And we could see that HPV screening was very useful to determine those in need of earlier screening. And I think this especially feeds into the importance of having not a one-size-fits-all. We need to differentiate the services we provide for young people living with HIV. And as you may see, in some high-income countries, they've already recommended to start screening at age 21. So as conclusion, of course, this was a very small sample. It wasn't a proper study. So there's need to confirm this finding through a larger research, particularly looking at sexually active young mothers living with HIV who are at risk of contracting HPV even before age of 25. And this research can help to inform WHO guidelines, both at national and global policies. And I'm also very proud to present our fact sheet. This was co-created with the young people. It's based on the questions and concerns they had, which is also responded to in the fact sheets. It's available for free at our homepage for those that are interested. Thank you very much.